everybody. I must thank Dr. Rock for giving this opportunity to share the last one. My topic is the evolution of eco power organizations. I will finish with this, please. Energy is power. Power purpose from nuclear segment into small thin pieces so that they can be evacuated by the fluidic system. And the last removal modalities, we have three parameters: ultrasound, vacuum, flow rate. Ultrasound, we understand it propels, while vacuum and flow rate would attract. True understanding of these three will help us in logical setting of the machines to enable us to tackle different surgical technique more efficiently. Even the most modern machine will not give any results as compared to an older machine that the principle of thermodynamics are not as the dynamics. Basically, we use these two things, the empties and the footprint tool. That is the type of tips we use. Energy level, our first goal is to move the lens with the least possible amount of energy. Each machine has a fixed rate of vibration, 35,000 to 45,000 per second. It's a fixed. While changeable is when we change the peak power, we are changing the stroke length of the peak tip. You understand that? Basically, the frequency, number of pulses per second. Pulse duration means the time of peak power on. Duty cycles, time on plus time off. Interval duration, time from one pulse to another pulse. Cycle time pulse duration plus interval duration. In cycle time plus duration is added to interval, whereas in interval we exclude the pulse duration. And we have absolute echo power and elapsed echo time. Absolute echo time is total amount of echo energy actually used during the process. And absolute echo time, we denote it as ATT, is equal to elapsed echo time with an average echo time. It makes sense that if you have delivered 15 seconds of energy at 100% power, it's about the same as 30 seconds at 50%. Or 60 seconds at 35% of power. This is because of, for each of these three examples, the absolute echo time is 15 seconds. And duty cycle, ultrasound on and ultrasound off. Example, 50% duty cycle on means ultrasound is 50% of the time is on and it's off 50% of the time. 25% duty cycle means it's on only for 25% while it's off for 75% of the time. Change in stroke length is based in percentage. Percentage means how much of percentage of our length of the tip is moving forward out of total length of the tip. If the stroke length of the machine is 3 milli-inches, average stroke tip is around 2 to 4 milli-inches. And if we use 100% echo power, means the whole 3 inches moving forward out of the sleeve, but yet power is 20%. That means only 20% of the total length, that's a 0.6 millimeter, where it is moving forward. More power, more distance moved by the tip, more cracking power. Longer stroke length are prone to generate excess heat, we must understand this. The longer the stroke length, the greater the physical impact of the lip is at the generation of the cavitation force. Stroke length is determined by foot pedal insertion in position 3 during the event before the finger. To understand the finger power, bigger the length, that's the power, smaller the length. And the different modalities, traditional continuous echo or a slow pulse echo has the potential to cause length center and reduce efficiency probability. Much discussion recently about microburst and hyperburst technology. Burst of echo different on-off proportion with an individual cycle. Burst has a traditional used fixed power. The different modes we have the basic modules, the continuous mode, pulse mode, and the burst mode. Continuous, we have a continuous generation of the force inside the nucleus, while in pulse mode we have intervals in between when we are not using the power actually. Pulse mode is further to have a 2 pulse per second. We have 250 microseconds when the power is on, then it's off, then it's on, then it's off. So 1 second is divided into 4 seconds. So is in 4 pulses per second means you divide this into 8 and 10 into 20. So the power you actually use inside the nucleus, this is 50% on and 50% off. That's how you can have different volumes, different power uses. Pulse of energy are delivered at a defined rate of pulse per second, which is the number of cycles per second. Yes. The default cycle for pulse mode is to have the peak of energy on and then off for equal period, 50-50, thus giving a duty cycle of 50%. This is controlled by either the foot control or by the pedal. Pulse mode is, again can be progressively increasing, or you can divide it into different burst mode with a different interval in between. So the burst can again be a continuous power rising, or it may be a pulse rising, or it may be a burst. You are giving the linear mode and then you are having intervals. Two forces with pulses versus attraction they occur while you put on the power. There's on, it's a repulsive force. When you leave it, it's a suction surplus aspiration, and during power on, there's emulsification and heat is produced, while the internal in between mechanical removal material no heat should build cooling the center surge. Pulse mode, 2 pulses or 6 pulses. 2 pulses, say smaller pulses, we need to hold the lens for chopping or bringing material in the central area. More pulses while sculpting to move the quadrant when you have break the fragments of field. Burst, higher burst, longer burst, continuous burst while sculpting. To move the quadrant, you can increase the burst and still less power will be placed over. Further, to hold lens is in chopping or bringing material in the central area. The amount of vapor energy delivered in an eye effect for the material sense, so that goal is to use enough ultrasound, just enough ultrasound. We have different things. Is we can divide it further, we can add the other aids. High vacuum phaco tip, there are different type of phaco tips. We can module the pulse or the burst mode. So tracking, the power, high vacuum used. For the tips, there are different sizes of the tips, different shapes of the tips, which we can help us by holding or delivering the power inside the tip only, like Cobra tip for the camera tip is going to help us for the easy penetration into the nucleus. Last tips to the last opening allow holding and removing large bits of material. Focus the US energy to a more concentrated area. Emulsification occurs inside the tip, not just at the tip, highly efficient, less ultrasound time. So in the routine ultrasound, the power is a linear. The sonic, another form, there is a gravitational force of 20 degrees and also when you use a chemical. So new sonics handpiece, it has an ultrasonic and a sonic dual system. We can change the duty cycle to a hyperpulse. High pulse rates can be achieved with the on and off times as short as at 4 milliseconds, giving an effective pulse rate of 125 pps since each cycle is 8 milliseconds. Harder lens requires more ultrasound to increase repulsion, reduce efficiency. Maximizing use of a vacuum, spend more time in foot position 2 and less in 3. Continuous pulse or burst. Continuous most action repulsive pulse, less mechanical actions allow fluids to work between the pulses, reduce pulsion due to less effect and more vacuum. Burst, potentially most economical mode, allows fluids to have a maximum effect. Pulse, for the circle lens, low power, 30% higher duty cycles, harder lens, high power. Do not select too high pulse stage. Pulse or a hyperpulse. Pause between pulse allows fluids to work as I told you. Too long pause, reduce ultrasound efficiency. Too short pause, reduce fluid efficiency. Do not select too high pulse stage. High BPS and duty cycle appropriate for syncope, increase power dissipation and repulsion, but still vastly better than continuous mode. Hyperpulse, smaller segments of the ultrasound, less repulsion, increase thermal safety, tendency to move nuclear material, less pouring in the lens, surgical disadvantage is less cutting efficiency in the lens. Burst allows maximization of the fluids by delivering precise number of bursts appropriate for giving cataract grades. It requires attention to cut into movement progress at a good foot dexterity. Fixed burst power needs to be selected for each cataract grade, linear forward, more or universal, but on hard lens, the lower range may not be effective. The burst can be a variable duty cycle or say the fixed burst or a linear burst. Linear burst, less repulsive forces, enhance control and versatility of energy delivery. Physicians can automatically respond to a different length density. What does this mean in practice? Low duty cycles deliver less energy, therefore should be required to contain them as endothelial vulnerable. This has been done on quadrant removal. Low duty cycles, because they appear less efficient, can cause problems in heart delivery. There's other procedures are torsion or phaco. Oscillatory torsional amplitude creates lateral tip movements that cuts more efficiently due to less repulsion. Because the linear forces go to repair, less resistance to the shearing factor, and results in decreased thermal energy at the incision. Improvement on ultrasound, less repulsion, which improves the flowability, less heat. This is a tip which is used in proposal. Calmer tip generates the same stroke tip as phaco, but in transverse direction. Oscillations are 30 kHz, lower than 40 kHz in phaco tip results in 20% energy saving. About 50% slower stroke at the incision than phaco due to geometry of Calmer tip. Overall, about 2/3 less heat at the wound site. Stroke at incision is reduced. So, torsion is a traditional phaco. Torsion cuts lens by shearing. Phaco longitudinal breakdown lens by jackhammer impact. Torsion is most efficient when applied continuously. Pause will slow down the removal. Phaco's best impulse or burst to minimize repulsion by using high vacuum, decrease friction, flowability, save time, post-mortem results clear clearly. Thermal advantages, torsion improve decrease heat, improve patient outcome, clear cornea, safer for plus 4 lens. Clinical benefits: reduce post-mortem occlusion cells, no compromise in fluid parameter even when incision size is reduced to 2.2 or lesser than that. Provide ability to work at lower bottle height, which helps in minimizing turbulence. Further reduction in blood cells will help in reducing the incidence of post of CME. Ozone and heart cataracts has been already discussed. This is quite helpful. In conclusion, balance the repelling and attractive forces. Select power and duty cycles to balance fluids when using pulse, modern ultrasounds, highly efficient UL ultrasound with a good power modulation capability allows the surgeons to choose a modulation pattern which is appropriate to the technique or the patient risk factor. Surgeon with a good foot control can further minimize energy delivery in the burst. Thank you.